Welcome to The Explainer. Today, we are diving into one of the most talked about medical cases to ever hit our TV screens. With the help of OBGYN Dr. Mama Dr. Jones, we are breaking down a truly wild, high-stakes episode of House MD. So buckle up, because this one is a real roller coaster.
You know, the entire episode really hinges on this one pretty terrifying question. It's a premise that totally pushes the boundaries of medicine and TV drama. It dares to ask, what if the pregnancy itself is what's making the mother sick? Maybe even fatally sick.
Classic House, right? This brutally honest line just perfectly sets the stage for the intense medical mystery that's about to unfold. The pregnancy is immediately framed not as this beautiful thing, but as the potential villain of the story. Okay, let's get into the case.
So, our story kicks off on what seems like a totally normal day. We have a pregnant photographer, she's on a photo shoot, and then, in a split second, everything just changes. Her work is violently interrupted by a terrifying and very sudden medical emergency.
She starts showing these classic, absolutely terrifying signs of a stroke. Her face is drooping, one arm goes weak, and her speech gets all slurred. Now, the crew around her is understandably completely confused, but these are textbook warning signs that something is horribly wrong. And what makes this even more alarming is the connection between being pregnant and your risk for having a stroke. Dr. Jones confirms that, while it's still pretty rare, the risk of a stroke is significantly higher during pregnancy. So why is that? Well, it all comes down to hormones. These big changes make your blood way more likely to clot, which can lead to something called an ischemic stroke. Or, on the other hand, dangerously high blood pressure could cause a hemorrhagic stroke, which is literally bleeding in the brain.
Okay, so the patient is rushed to the hospital, but her condition is just getting worse. It's not just the stroke anymore. Now her kidneys are starting to shut down. And this sends Dr. House and his team scrambling down this massive rabbit hole of potential diagnoses.
So the most obvious culprit here is preeclampsia. A stroke and kidney failure during pregnancy, that's a pretty classic presentation. But as Dr. Jones wisely points out, you don't call in a world-famous, rule-breaking genius like Dr. House for something a first-year resident could probably spot.
So next on the list is HELP syndrome, which is basically a life-threatening, supercharged version of preeclampsia. The name is actually an acronym for its terrifying symptoms. But here's the thing, there's a huge piece of the puzzle missing. The patient's blood pressure is totally normal, which throws a major wrench in both the preeclampsia and the HELP syndrome theories.
So, House does what House does best. He digs deep and comes up with this theory that is so obscure it's almost brilliant. He connects a long-forgotten, untreated strep throat to rheumatic fever, which he claims damaged the heart valve, leading to a clot that caused the stroke and the kidney failure. It's this wild, almost unbelievable chain of events. They even do this risky procedure to fix the valve, but her kidneys just keep on failing. It's another dead end.
Okay, so the patient is getting sicker by the minute, all their leads have run dry, and the case takes this incredibly dramatic turn. House proposes a truly radical idea, one that flips the entire investigation completely on its head.
He asks this question that changes absolutely everything. What if the problem isn't with the mother at all? What if the fetus is the one that's sick, and the mother's body is just a mirror reflecting all of its symptoms? And that leads them to the jaw-dropping, central diagnosis of the entire episode, maternal mirror syndrome. Now, this is a real, but almost mythical condition where the mother's body literally reflects the illness of her fetus. It is so rare, so obscure, that even Dr. Jones, a practicing OBGYN, admits she had never even heard of it before.
This is where things get really crazy, and it's a perfect example of the show's love for high-risk drama over, sound medical practice. The team decides they need an MRI of the fetus's heart, which means they have to inject a paralytic to keep it still. Dr. Jones immediately calls them out on this, asking the obvious question, why not just start with the safe, standard ultrasound? But hey, this is House, so they go forward with this dangerous needle in the umbilical cord procedure, only to find out the heart is perfectly fine. The real problem? The bladder. It's massively enlarged and is literally crushing the baby's lungs.
So the diagnosis is finally made, but now the mother's liver is failing. Time is completely up, and this pushes House to propose a solution that goes way beyond risky diagnostics into, well, an unprecedented and incredibly dangerous gamble.
This one line from House. This is where things escalate, big time. He's no longer just trying to solve a puzzle, he's proposing a wildly experimental surgery on a 21-week-old fetus.
based on pretty much nothing more than a hunch.
All right, let's be really clear about what's happening here. Open fetal surgery is a real thing, but it's an incredibly specialized field. What House is proposing is what Dr. Jones rightly calls cowboy medicine. It's a reckless, experimental, exploratory surgery on a pre-viable fetus with no real plan. In her expert opinion, this isn't just risky, it is incredibly unethical.
And the terrifying risks of this gamble become horrifyingly real in an instant. Right there on the operating table, the mother goes into ventricular fibrillation. Her heart just stops. The team has to frantically shock her back to life, right in the middle of this already insane experimental surgery.
Of course, in the world of television, the surgery is a miraculous success. They find a tiny little lesion on the lung, they fix it, and both mother and baby are perfectly fine. But Dr. Jones uses this quote-unquote miracle to shine a spotlight on the enormous and, frankly, dangerous gap between TV medical drama and the harsh reality of medical practice.
I mean, let's just break down this comparison. Real medicine is all about evidence-based practice, teamwork, and making sure patients are fully informed and give consent. What the show portrays is the polar opposite, a lone genius, a cowboy, performing an unproven, high-risk experiment with zero communication that just so happens to result in a perfect instant cure. This isn't just drama, it is pure fantasy.
And this brings us to Dr. Jones's really powerful and, I think, crucial final thought. She expresses this deep, palpable frustration with these kinds of storylines because they create dangerously unrealistic expectations. Patients who are in real-life crises might actually believe that these last-minute Hail Mary procedures are a routine option with a high chance of a perfect outcome.
So what's the big takeaway here? This episode of House is, without a doubt, gripping television. But it's also a powerful and necessary reminder that real medicine is a world of teamwork, of ethics, and of slow, hard-won progress, not lone geniuses and last-minute miracles. Thanks for joining us for this deep dive into the world of medical drama versus reality.